Hi, my name is Christina. I'm a nurse practitioner for Maine Family Planning. This is a video about how to inject your testosterone or your estradiol, and this is going to be sub-Q or subcutaneous injections. First, we're going to talk about all the equipment. You want to make sure that you have 2 alcohol pads. This is saline today, but this will be your testosterone or estradiol. Gauze or Band-Aid, those are optional. And then you need your syringe with 2 needles. You have 2 type needles. One is going to be a large one, usually an 18 gauge. That's to draw up the medication because the medication is very thick. It's submerged in oil. The other one is the smaller needle for injecting. We do have step-by-step directions that you can follow, and I'm going to do the summary of it. So first you're going to pop this up. Just take your thumb, pop it right off. This is sterile. So the very first time that you pop this off, it's sterile. Don't touch it. After that, because it's a multi-use vial, you'll have to alcohol it. So once it's been opened and you've already used it, you're just going to alcohol the top of it to make it sterile. Once it's clean, don't touch it. You're going to open your syringe and put on the large needle. Some of them screw in. This is a screw type. Some of them just stick on. This is a 1 milliliter syringe. You're going to draw back to where your dose is. In this case, we're going to use 0.2. So you're going to draw back to the 0.2. You're going to inject that much air into your vial. So invert your vial, inject the air in, and then draw back to 0.2. If you get air bubbles, flick them up and squirt them back in. You don't want the air bubbles because then you're not getting medicine, you're getting air. So once I'm at the 0.2, I can take this off. And now I need to switch my needles. Carefully recap if you're recapping. Take out your other needle. I'm going to untwist this one and twist this one on. So now I have the smaller needle that I'm going to be using for injection. I'm going to push it up just until I can see a little medicine up at the top. Putting that aside, make sure you have a sharps container to dispose of properly all your sharps afterwards. Now we're going to prepare the site. Generally the most common site that we use is around the belly button. On our worksheets we have a couple different sites you can use. The belly button is the easiest to do, especially if you're doing your own injections. The most important thing is that we're not going down to a muscle, so you don't want to go straight in because you'll hit the muscle. You need to go in at an angle, and we usually say a 45-degree angle. You're going to pinch the skin to make sure you have just the fat tissue and inject it this way. So pick your area that you're going to use, open a new alcohol, and alcohol out in a circle. You have to let that dry, otherwise it'll sting. We're going to pretend this is dry. This is our little needle. You're going to pinch the skin and inject it at a 45-degree angle, right in like that, and then push. The medicine is very thick, so it's going to take a lot of pressure to push this. When you withdraw, you may notice a little bit of medicine left over. If that's the case, you can just blot it away. Most people don't need a Band-Aid, but if you feel comfortable, if you feel like you need a Band-Aid, you're more than welcome to put one on. And that is how you inject. And of course, make sure you throw away all your sharps into your sharps container. Good luck.